there's just so much.
You're listening to a Mamamia podcast.
Hello, and welcome to Well, the podcast for your health and body explained. I am Dr. Ginni Mansberg. I am a GP. I'm also a women's health expert. I'm basically really interested in the weirdest, wackiest body functions available. I'm also really obsessed with evidence, which is going to sound counterintuitive, but I like to give it to you straight, what we know, what we don't know.
And I'm Cath Mahoney, a comedian, author and self-proclaimed hypochondriac. Love that for me. This is a show of my dreams. So, what are we going to be discussing today, Dr. Ginni? The 3 a.m. club.
Yeah, I'm in that one.
So am I. Why we wake at this time and what to do about it that doesn't involve reaching for your phone and doom scrolling. Also, the surprisingly common dilemma of chronic constipation, double C's. There is a chat you need to hear from my friend Dr. Ginni and asking for a friend. Your anonymous, awkward health questions. We're talking bloating and chin hair. I mean, let's say that's a hard relate from me.
But first, it is time for What the Health? Your quick dose of women's health headlines.
This is a chat you need to hear.
What the?
Oh, what the?
This is. I don't understand.
What the health?
Okay, Cath, this was a study that, quite frankly, I found a little bit depressing. You know how none of us are getting enough veggies, very few of us are getting enough fruit? Well, this was a study of 30,000 people that focused on this particular subgroup of fruit and veggies called flavanols. They are like flavanols. They're these
flavanol. I think he was my waiter in Greece.
Was he hot?
Yes.
So apart from hot flavanol in Athens, we also have this group of antioxidants that are meant to do amazing things, outsized things for your heart. And so you find them mostly in plums, blackberries, cherries. They're like highly coloured things. Broad beans as well. Love a good broad bean. And green tea. So apparently, in this study of 30,000 people, there are very few of us who are getting enough flavanols a day. So apparently it's not just that we're not getting enough fruit, we're not getting enough vegetables, we're not getting enough protein, goodness knows that, we're not getting enough calcium, we're not getting enough fibre, so we all need our 25 grams. Now we also need to add flavanols into a mix. I'm now retiring because I can't do this anymore. This is way too much. So I was getting really depressed when I read this study until I did hear a little bit of a disclaimer at the end from the authors who were saying that there's simply not enough evidence to support that flavanols are their own category of foods that we need to worry about as much as the protein, the fibre and the calcium. So thank goodness I'm just not going to worry about hitting my berry target or my black cherry target right now.
Not my plums.
Yes. I think if you get a plum good on you, you can wear an extra halo. But until then, the rest of us are just struggling to get enough cucumbers. But Cath, that is not all we have in What the Health.
Okay.
I have another story for you, which was, again, a little bit of a downer, I'm not going to lie. It was a Monash University study that found that 1 in 5 women get extreme pain when they had an IUD inserted. Now, you had an IUD inserted. How was it for you?
Oh, out of 10, I would say it's a 9.5 pain threshold.
Yeah.
But I'm a wuss. I'm a wuss, so
got
I
it.
probably don't do a study on me.
So for anyone who's never had an IUD put in, or if you're the sort of person who's lucky enough to have had it put in under a general anaesthetic and you just wake up and it happens to be there, let me just explain what it is. An IUD is about a 3 centimetre long little plastic device that is designed to both prevent pregnancy and in some cases they have a bit of progesterone in them that is released slowly and can actually narrow the lining of your uterus and make bleeding go away. So really good for heavy menstrual bleeding. In order to put it in, it's a little bit like a pap test on steroids. So we put in a big speculum that needs to open everything up and then we need to dilate your cervix using some cervical dilators. So your cervix is the entrance to your womb. There's a little hole in there that if you've ever had a baby, your baby came out that way. So it's stretched to the size of a head, a baby's head. This thing we're trying to put in there is only like a couple of millimetres wide, but we do need to still stretch it. That act of stretching is not dissimilar to being in labour. That's what labour is designed to do, is to stretch that little opening of your uterus so that a baby's head can fit out and the rest of the body as well. We don't just deliver the head, just in case anyone was wondering on that one. But it is not a lot of fun. And then once we have dilated your cervix, then we actually use this sort of injected it's not a needle, it's actually just is used to put the Mirena or the other IUD in exactly the right spot. So your doctor will measure how long it needs to be and they put it in exactly the right spot because it's got to be at the top of the uterus, not the bottom. The entire thing can take, if you're really lucky and your cervix dilates really quickly, it can be like 10 minutes. Otherwise, like it can be like 20 minutes. It's not a lot of fun. Mine was actually okay, but I don't back that 1 in 5 rate. I think a lot of women have a lot worse pain than that. This study said that it's not about the procedure per se, that there's a lot of personal experience with pain and life stresses that go into the whole insertion procedure, and that in fact, if we just reassure women that this is a very positive experience that they're going to be having and that it's not going to be too painful, we can actually impact the experience of it. I'm calling BS because in my experience, women really don't like having an IUD put in. I think having it removed is bad enough for some women. But having it put in, and I'm going to put in a note for women who are a little bit later on in life, perhaps in the perimenopause phase where you don't have a lot of estrogen, everything gets a lot more painful down there, let's just say, and having an IUD put in is no exception. There was some separate advice that came out from Victorian Health last year, basically saying every woman is entitled to decent pain relief when she has an IUD putting in, that too many women are gaslit around this. And I was worried about this study being part of that. But basically in our surgery, we do offer the green whistle in case you
What's a green whistle?
Have you ever watched Bondi Rescue? You know how when someone like breaks their arm, they inhale that green whistle? Really good for short-term pain relief. We keep them in our surgery, and in our case, it's not for in case you walk in with a broken leg, which does not tend to happen that much in a women's health clinic, you'll be surprised to know. We actually keep it for putting IUDs in because they can be really uncomfortable. And let's not find out. Let's actually take some preemptive steps to actually not gaslight women around their pain.
Right. So you have a doctor's bag. I have TikTok.
Same.
Same. So in my doctor's bag this week, we're talking about ear seeding.
Hang on. So, Cath, can you just explain ear seeding for the uninitiated? I am seeing a whole lot of watering cans, sesame seeds, maybe some mung beans. What are we doing here?
Ear seedings, they're like tiny little beads that sort of are put on by adhesives. So they're very tiny, and they're being used in this instance and the social media trend to potentially get rid of swelling and puffiness on the face and jawline. Now, I have to confess to having had ear seeding.
Of course you have.
Of course I have. Just for a bit of stress. I can't even remember when in my life it was, but it's like acupuncture but without the needles, and there's a lot of pressure points in your ears. So I've had it for that. But can it actually change the shape of your face? I mean, is this even a thing?
So it's never been studied for that. Actually, there are some studies of ear seeding. So it sounds like complete woo-woo right up the Cath alley. But in fact, there have been some studies with some benefits found for things like sleep, pain, anxiety. The quality of the studies was a bit meh. But you can say that there is some science behind it a little bit. It's certainly not been studied for depuffing your face. When I hear puffy face, can we just say that you don't go off and get your own ear seeding kit off from Amazon? Can we just go to your GP? Because there are some conditions like kidney problems that can actually give you medical face puffiness that we are not going to do any ear seeding for. We're actually going to go and get medical treatment for that and actually get a diagnosis. So that's my first thing that I want to say. If you just think that you've gained a little bit of weight and your jawline is not as crisp and angular as you would like it to be, I can't see any plausible possible way that an ear seeding could even vaguely change that. I think you need to go and spend thousands with an esthetician. But if you want to do that, and if that's where you want to put your hard-earned cash, I can't see any problems either because I can't see that it's going to do any harm.
Okay, up next, we need to talk about those frustrating middle-of-the-night wake-ups. Why do so many of us find ourselves wide awake at 3 a.m?
How are you? Well, how are you feeling?
Are you well?
Are you well?
Okay, Cath, moving on. We're up to Are You Well? I love this segment. We do a bit of a deep dive on some of the health conditions that a lot of us have experienced but often don't really understand. And this one is waking up at 3 a.m. or any time in the middle of the night and just staring at the ceiling. Hard relate. I know you can
Double
too.
hard relate. That's two relators. Yeah.
It's just so common. I think most people who do actually wake up multiple times in the night, they're just not necessarily aware of it. They might just roll over, go straight back to sleep, and they wake up the next morning not having remembered that, if you had a camera on them, they are waking up regularly. But suddenly things change, and now you're waking up at 3 a.m. and You're now doom scrolling. You're wondering what is wrong with your life. So today we want to unpack exactly what's going on, why it's happening, and most importantly, what you can do about it, because that's really, really important.
And obviously we're going to tackle it because sleep is the cornerstone of life and is very important.
Okay, Cath, I think the first thing we need to talk about is what is normal sleep. And I think there's this stereotype that you should go to bed at, let's say, 11 o'clock at night, fall asleep within like 10 minutes, sleep through the night for 8 hours, wake up the next morning, jump out of bed feeling super refreshed and ready to enjoy the day. And that is definitely very common for, let's say, some 20-year-olds who have no anxiety. Good for you. For the rest of us, I actually spoke to friend of Well and friend of Very Perry. If you haven't checked it out yet, you've got to go and check it out. Yeah, even if you're only 25, it's so fascinating. But Amelia Scott is a sleep specialist and she's a psychologist who specialises in sleep. And I was shocked to hear that she was saying to me about half of her patients are actually people who are panicked about their sleep and in fact it's fine. So she was saying it often takes more than half an hour to get to sleep. Like that's not uncommon. Most people will wake up in the middle of the night, do a trip to the loo. As long as you're getting back to sleep within about half an hour, that's fine. You're not going to have catastrophic sleep deprivation until you're sort of getting below 5.5 hours of sleep. So even if all you're getting is 6.5, 7 hours, you might feel a little bit tired the next day, but it's not catastrophic for your brain. And for most people, you're going to feel tired for maybe the first half hour after you wake up. And I really wanted to explain that to Well listeners because I think it's so important to not panic if your sleep is in the realm of normal. A lot of people struggle to fall asleep and that is really linked to anxiety. That's your real hallmark of anxiety when you go to bed and as soon as you lie down and have got nothing to do, you are wide awake. And then what do? We turn to our phones. And now we're doom scrolling through Instagram and TikTok and now you're not going to fall asleep because now you're really stimulated by the screen in front of you. And that's one problem. Another problem completely separately is the women that I see who fall asleep within 2 minutes because they're just exhausted. Even if they're going to bed at 9 o'clock, they are absolutely wiped out. And the reason is because they're really not getting a great night's sleep. And they're up at maybe 11 or 1 or 3 and now their heads start to tick over and you think you're doing yourself a favour by grabbing your phone. The worst time to get on a screen. And we're actually now in a really bad space with really bad habits that we need to break. And in most cases, it is just a bad habit. But should we just go through the quick medical things we need to check off the list?
Yes, please. Let's go.
Okay. The first thing is there are certain medications that can really mess with your sleep. Antidepressants, steroids. If you're on any steroids for any reason, like if you've had a recent flare-up in wheals and hives or asthma or you've got joint swelling and you've gone on steroids, your sleep is going to go to the dogs. I'm really sorry about that. There are cough and cold medications that can really mess with your sleep. So just check in with your pharmacist if you're not sure. There are even some supplements that can mess with your sleep quite a lot. There are some health conditions like sleep apnea. If you're snoring, particularly if you've gained some weight, anything that hurts is going to wake you up at night, like nasty shoulders and hip pains, things like that. Reflux, if you've eaten too much, if you've had dinner too late, especially with a couple of drinks, if you're waking up feeling a bit gross in the guts, reflux is a really major issue. Restless legs, ridiculously common. Cramps, should I go on? There are so many
I've
things.
just said yes to pretty much all of those things. And what about booze? Booze and caffeine, surely that must impact.
Can I just tell you, I'm in a run of the last 2 weeks of so many of my patients telling me that for a variety of reasons they have given up alcohol and their life has transformed. Symptoms that they thought were to do with perimenopause or anxiety disorders or all sorts of things. Reflux is a huge one.
Yep.
Gone. They've gone off the alcohol and they're never going back. I am planning to do this at some point in my life. It's an aspirational thing for me, but I'm not there yet.
It's true. When I've gone off the booze, everything just clicks into place.
Changes.
Caffeine, this is where I'm a bugger because if I've had a crap sleep and I'm tired and I've got to push through, I'll have coffee in the afternoon, later than I would, and it's all fine for the afternoon's worth of work. And then I definitely feel like that affects me getting to sleep or staying asleep.
Do you know that's genetic?
What?
50-50. So I can have a double shot before I go to sleep and sleep like a baby,
My
no
dad
problem.
can do that.
Yeah, it's in your genes. And then there are some people who they can't have any coffee after like 1 p.m.
Yeah.
That's going to really wreck their sleep. So you just got to know your own body and whether that's an issue for you. So let's take all of those things and park them to one side and just make sure that you've kind of ticked off and seen the doctor about anything medical that you need to. Now we're going to move on and go, what are the bad habits that are actually making you awake at 3 a.m. that we need to deal with right now?
Dr. Ginni, hit me with it. What have we got?
So your enemy is your screen. And I hear a lot of people go, but I need my phone next to my bed because I have my alarm on my phone. So I have excellent news for you. You can buy an alarm clock. Remember the type that you had when you were a teenager, if you're old like us, or if you're like in your 20s, you've probably never seen such a thing, but it actually does exist. They plug into your electrical socket and you can set an alarm and it will go off and it doesn't have a phone attached to it. They still exist and they're not expensive.
Have just recently bought one, so I'm feeling very smug so far. Keep going.
Yes, I know. How good are you? I actually think that if you have teenagers in your house or if
Get rid of them. Bad news. They really screw your sleep up.
They do, don't
Good
they?
job. I'll take note.
Yeah,
Okay.
I know. Same with the dogs jumping on your bed at 2 a.m. Yeah, they're not good either. But we're not going to.
We won't get rid of them.
We're
all
not
right,
getting rid of the
okay.
teens or the dogs.
Right.
They're going to stay, or your cat. They can all stay. But I do think that the whole family should actually put their phones and laptops and iPads and other devices in another room. Like that has been shown in studies to be amazing for your sleep. And then we've just got to get all of your good habits back into place. So we sometimes call this sleep hygiene, which has got nothing to do with the state of your sheets. It's actually all to do with your brain getting used to associating being in bed with sleep. And sometimes we just got to break the mold and remake it again. And how we do that is if you wake up at 3 a.m. and your phone is nowhere in sight, we're not going to go get it. We're not going to jump on the laptop. Instead, what we're going to do is we're going to try and do some deep relaxation exercises and see if we can fall back to sleep. If after 10 minutes that has not happened, this is going to shock you. Actually going to get out of bed.
What?
Yeah, we're going to get out of bed and you're going to do something that is useful, like folding the washing or unstacking the dishwasher, that is going to make you physically tired. But so we're going to break the association.
So you're getting me out of the bedroom.
We're getting you out the bedroom.
Okay.
You're going to actually put some good use to that time. If you're not going to sleep anyway, we might as well get the ironing done, right? And so we're also going to break that association of your bed with frustration. We're going to try and break that association.
All
so
right,
then
I love this.
when
I
you
love
feel
this.
tired, go back to bed 10 minutes again and see if you fall asleep. If not, up. So we've got to have lists of things that you – and like let's be honest, whether you're 15 or 80, who does not have a list of things that they need to do? There's always stuff to do.
Okay, but
So
no screens.
No screens. Screen-free stuff. No, we're not
Okay.
getting on Amazon and scrolling through all the supplements you want to
Watching
buy.
something on Netflix? No.
No. That's off your
Okay,
list.
okay.
Instead, this is very boring things. You can clean your toilet. You can get your bleach out. You can clean your toilet. You can dust your bookshelves. You can go through your underwear
Colour code wardrobe.
Colour code the wardrobe. Get rid of all the undies with holes in them. These are jobs you can do as long as you are going to do something that is useful but is not going to associate your brain with frustration. So your bed is allowed for two things, sleep and sex.
Oh,
not in your case, Cath.
Not in my case. Sleep. Great.
Sleep and maybe one day
Sleep
sex
and a
again.
self-cuddle.
Yes.
Great. Okay, so to recap, if we are waking up in the middle of the night, we first of all do not look at any screens. We take 10 minutes of deep breathing and trying to kind of relax ourselves. If we are still awake, we leave the bed. We go and do something that does involve a screen, but is of manual labour. And then we go back into bed and try again for 10 minutes and just hit repeat. Is this correct?
Yeah, and it actually works.
Okay.
It might take a few days, but you're not going to be sleeping anyway. You're not going to be more tired doing this strategy.
Yeah.
You're up anyway, but now you get
Now
up
you're
the
doing
next morning
jobs.
and go, wow, I've just done so many things I've wanted to do for the last 3 years.
Okay, up next. Why women over 40 are full of shit. Not us, obviously.
Okay, Cath, today we really need to talk about shit.
What?
I want to talk about chronic constipation, which is ridiculously common. The thing is that I do not go a day in my surgery without talking to women who feel bloated. They often show me a photo of themselves in the morning. They say, look, I look 6 months pregnant. They're often quite uncomfortable. What they don't mention to me is the fact that they haven't taken a dump for like 3 days. And often when I ask them, they haven't even registered it, which is kind of a good thing because I don't really want you cataloguing your shit into like really minute details, and definitely do not send me a photo. I'm not interested. But to a certain extent, we're missing the memo about the fact that we're not shitting enough. So should we talk about what a good shit should look like?
Yes, but first of all, are we embarrassed to talk about that? Is that something that is on the embarrassed list? I talk about it every day to anyone who'll listen, but I'm not typical.
You are not.
No.
You are out and proud with all bodily functions.
Yes. But are some ladies a bit timid around that?
Well, I'll often ask them directly, how are your poos going? And they'll go, no, fine, no problem. But they haven't actually clocked the fact that one hasn't dropped for like 2 or 3 mornings. And I think the thing is, women are so damn busy that if the shit doesn't happen naturally in the window that they have allocated for shitting, like between 7:12 and 7:13 in the morning, that's it. They've missed that boat. They're too busy to actually stop at any other time and take a dump. I think that's what's happening. I don't think they're embarrassed.
You're right, though. It's a real small window, isn't it? Especially if you're trying to get everyone out the door or yourself out the door. Okay.
And you're a morning person.
Yes.
My husband's a night guy.
Is he?
Yes, it's weird.
Is that a thing?
He's a night owl in general.
Okay.
He goes to sleep late, he wakes up late and he shits late. It's really weird. But yes, I'm definitely your morning girl.
Me too. Yeah. Me too, especially after a little bit of caffeine.
Yes.
Straight in. So talk me through what you're seeing and what people should be doing.
Okay, so statistically, only about 40% of women are apparently constipated, but that doesn't really ring with my practice. I reckon so many more are actually really, really constipated, because even the women who swear blind that they're pooing every day, I'll put them up on my examination table and have a feel, and you can feel the poos. We call it, it's like a poo tumour kind of thing. Like it's not really a tumour, don't worry, but it's like a big massive poo. In the bottom left-hand side, it feels quite high and it feels like a sausage, like you can roll your hand over it. Yeah, you can feel it there. And the women are like, no, but I poo all the time. But the thing is, you've got to be doing a big log every single day.
So
if you're doing a plop,
it's quality.
Yes,
it's
if
not
you are
just
plopping,
okay,
1 or 2 plops a day, you're leaving some traffic behind. And then you're going to end up with the world's greatest traffic jam on the superhighway, and it's not going to come out.
So when you've got the sausage, how are we releasing the sausage?
Well, you will push and it doesn't come out in one plop. It takes, you can feel it takes 1, 2, 3, and then it's out. And, if you do care to have a look, there's a log in the toilet. But if you are hearing plop, 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 I know already that's not good. We shouldn't be hearing plops.
Is this as women get to a certain age it's happening, or is it for all is it for young women too?
Look, it can be for anyone, and it's often genetic. Like sometimes there's like a family of appalling pooers. Like,
really?
Speak to mum, speak to dad. They're just like, those people who take forever in the toilet. And you're like, what are you doing in there? Like, go in, take your shit, get out. Like, what are you doing in there? I think the very poor pooers, it often runs in families. I think the poor diet, not a lot of fibre. Yeah. Very hard to get out a full carb diet.
Like we know what fibre is. I'm nodding going, fibre. But then if you had to make me name 10 things that are fibrous, I'd be like, lentils. What fibre should we be having?
Salad, fruit.
Right.
Vegetables.
I didn't even know that was fibre.
Yeah.
Okay.
Whole grain bread. Yeah. Any grains are pretty much fibre. Your porridge in the morning. Your wheat bix, that'll do.
That'll do. Okay.
Yeah, there's fibre in a lot of places, actually.
So to get someone moving who's come to see you, who's really backed up, what is the process? What are we doing?
Okay, so Cath, this is my formula. And like everybody, I hope you've got your pen ready, because this is very, very liquid gold that I'm about to give you right now. Okay, this is for the average constipation. Like this is somebody who's been leaving a bit behind and is now feeling a bit bloated, and we probably have quite a major traffic jam in the highway.
Okay.
So your step one, it's counterintuitive, no fibre.
What?
Yep, no fibre.
Okay.
Yeah, because we are not sending more traffic into the traffic jam. We've got to clear the clogged traffic that is there first, and fibre just sends more traffic. There's more stuff to go into your large bowel. So we're going to switch off the fibre tap. You're going to go for your white bread, your white rice, your cooked chicken, maybe a few cooked veggies.
Oh, this is like colonoscopy.
This is exactly the pre-colonoscopy thing.
It's the white dream.
This is why they do it before a colonoscopy, because your doctor doesn't want to have to basically burrow through a whole lot of shit to see your bowels, right? So they want as little traffic to the traffic jam as possible, right? And this phase, I call this the brick phase, right? Because you've still got a brick lodged in your bowels. We've got to remove the brick. So we're going to stop the traffic to the traffic jam, and you're going to drink 2 litres a day of fluid. Okay. Because a lot of women are a bit dehydrated. And then the third step is you're going to go to the pharmacy, and you're going to look for 2 key ingredients that are my favourite ingredients in the whole world, not laxatives.
Okay.
Laxatives
really?
Laxatives kind of irritate your bowel and make the nerves just go ka-ching, and then they go into spasm and push everything out. But then they tend to freeze like musical statues afterwards. Okay. And just the whole problem keeps going again. So no laxatives. What we're going to get is we're going to get a stool softener. You're going to turn your brick into plasticine.
A stool softener.
Yeah,
I love the alliteration.
Yeah, Macrogol is my absolute favourite there. Okay. And they come in either sachets or scoops, and you can have up to 6 a day. I'm going to say that this is for the not hardcore person.
For the big brick?
Yeah, this is for your big brick. This is like maybe you'll start with 1 or 2 a day, right? Okay. And at the same time, you're going to buy some liquid paraffin. Paraffin. It's a lubricant.
Are we going camping? What are we doing?
Don't pour this in your petrol cap, okay? No, instead what we're going to do is we're going to drink this not too late at night, because it can give you a bit of reflux. So before dinner, ideally, about 30 mils. You're going to down that because it's a lubricant, and it's going to help lubricate the brick. So once you've got your low fibre, your Macrogol, your lubricant, your plenty of fluid, you're going to keep doing that until you get lift off.
Wow.
Lift off can happen over a couple of days. Okay. But you'll be going, holy shit balls, was that inside me? That is absolutely terrifying.
Is it like the stuff you take for colonoscopy? Like, is it going to be an explosion?
No.
We're not going to need to be near it. Much gentler. Okay, good to know.
I would not be going to that kind of pre-colonoscopy stuff without talking to a GP first.
Yes.
But this is just for your average bloated, constipated person, right? So you're just going to get lift off, and there's going to be a very large and very impressive series of massive bogs in the toilet. Oh. And they're going to double flushes for sure, and you're going to be really, really proud. You're going to want to put them on Facebook, but don't.
Double flushes.
Don't put them on socials.
Sometimes I've had the best poo ever, and I've literally almost sent it to a friend. So I get the Facebook sharing.
They send them to me,
Cath.
I
love
they send
that
them
you
to
get
me.
Poo
It's
photos.
just my favourite thing ever.
Great.
Yeah, especially before dinner. But anyway, after liftoff, which is your post-brick phase, you're going to bin all that white food. Never to come out again unless you go
Fiber's
back in. Fiber's back.
Which is of all the things that we talked about. Yes.
You're doing fibre with fibre sauce. You're going with your Wheat Bix. You're going to put some broccoli on your Wheat Bix. No, that's gross. But we're really going hard on the fibre. Lots of water. The only thing you're going to leave in your arsenal from the pharmacy is your Macrogol, 1 a day for actually between 3 weeks and 3 months. And that's because when you've had a lot of constipation, the nerves that are actually supplying the muscles that are meant to squeeze the poo like a toothpaste going out of a toothpaste tube, they go into freeze frame. They don't work that well. So we've just got to make it easier on those nerves while they just kind of come back to life.
A bit of a car service going on for your internals.
Yes.
Okay.
And just a reminder that if you have had a change in bowel habit, definitely do this, but I think it's always worth going and checking in with your GP, because changes can mean that there's something a little bit more serious going on. Now, that's unusual, and hopefully if you're the sort of person who does your poo test and sends that free shit back to the government, once every 2 years, you're going to be really, really happy. But for everyone else, if you're not sure, just go to your doctor. But it doesn't have to be one or the other. You can actually remove your brick while you're making your appointment to see a GP.
Perfect. Okay. Let's free those bricks.
Up next, the most common complaint I get in my practice from women of all ages.
Up next, asking for a friend why your stomach suddenly looks 6 months pregnant by 4 p.m. And what's with the random chin hairs?
I'm just asking for a friend.
So, my friends, they want to know.
It's not for me.
# just asking for a friend.
Okay, now it is time for asking for a friend,
Love this.
where we 1000% know you're probably not asking for your friend, you're probably asking for yourself, but you're in a safe space and we will answer your friend's question, we promise. Okay, today's question comes from Sylvia, who's 38.
Oh, hey, Sylvia. My mum's name is Sylvia. I love that
Lovely
name.
name.
Yeah.
Hi, Dr. Ginni and Cath. Asking for a friend, but yes, the friend really is me. I'm 38 and by the end of most days, I look about 6 months pregnant. I wake up feeling fine, but as the day goes on, my stomach does get bigger and tighter, honestly, to the point where my clothes feel really uncomfortable. I've tried changing my diet, cutting out different foods, but nothing seems to be helping. Everyone says bloating's normal, but surely it shouldn't be this constant. At what point should someone stop blaming food and start asking whether something else might be going on?
Roundabout now, Sylvia, I think would be a good idea. I think that any bloating that has gone on this long, I think you do need to go and see a doctor in the teeny chance that there is something medical causing it. So whether it's coming from your ovaries or your uterus or something in your bowel, we need somebody to lay hands on your belly and actually feel it and see if we can feel a lump. Now, I'm going to fast forward and say that you've done that and we found nothing and maybe we did an ultrasound, everything was completely normal. What causes the belly to expand and contract? So it's not fat because that takes a while to come on and takes a longer while to come off. And it's unlikely to be things like fluid. They take a while to come on as well. So if it comes and goes, you haven't told us how it goes, I think you've farted it out. And the answer is that you're probably full of gas. And different people make different amounts of gas. And
I make a lot of gas.
Gassy
throwing
Cath.
it in there.
Yeah. Thanks. And Sylvia, we appreciate that you share that you make a lot of gas too. You and Cath can have a gassy party.
Gas off.
A gas off. And so actually it's not you making the gas, it's the bacteria in your guts, your microbiome. And your microbiome thrives in different ways and different bugs make different amount of gas that is variously smelly and sometimes not so smelly. Actually, most of the contents of your gas are not very smelly at all.
No, just noisy.
Yes.
In my case.
Yeah. And you're right. I think it was a really good idea, Sylvia, to try different foods to see if they drive different responses from your gut microbiome, but you might not have tried long enough. So you can't cut asparagus out for a single meal and go, well, that didn't help, because by the time it gets into the gut, so it's not going to change your microbiome. You might need to change your diet over a longer period of time. So let's say, Sylvia, that you have cut out a FODMAP. Have you heard of FODMAPs?
I have, but tell me what it is because I've forgotten what it means.
They are fermentable oligosaccharides, disaccharides, monosaccharides, and polyols. I know. I say that all the time.
Saccharides and polyols.
Yes.
There. And what's that?
They're basically ingredients of mostly fresh foods like onions, garlic, but also like lactose, gluten. They're in avocado, they're in apples and pears. So like if you look them all up, a lot of people have to cut out various FODMAPs to change their microbiome. It's very useful in irritable bowel syndrome. But the thing is, when you cut them out, we can't just cut them out for a single meal. So let's say you go, I'm going to not have any apples for the next 3 hours. That's not enough to really see whether it's going to impact on your microbiome and your bloating. And sometimes you need to do that with the help of a dietitian. So maybe go to see a dietitian as well if you're going to go on that
route,
journey.
yeah.
The things that often are really driving a lot of gas is fake sugars. So if you're having like sugar-free lollies that are processed, if you're having a lot of protein shakes, like a lot of those protein powders are full of fake sugars. They can make people super gassy. Like weight loss shakes, have you seen? They are often full of fake sugars as well. So check what you're eating. Maybe take all of it to a dietitian and see if they can help you get to the bottom of what is causing your bloating and farting, because they come together as the odd couple, as a pair. They do come together, and let's go from there. But don't forget, doctor first.
Okay, and second up, we have a relatable question about chin hair. This time from an anonymous listener. Dr. Ginni?
Makes sense.
Hi, Dr. Ginni and Cath. My friend is 31 and recently they've started finding random dark hairs on their chin. One day there's nothing there, the next day it's somehow 2 centimeters long. Is it just part of getting older, or could it be a sign my friend's hormones are out of whack?
I think, Anonymous, you could be onto something there with your friend's hormones being slightly out of whack. So when I hear chin hairs on a young person, and I'm old enough to say that a 31-year-old is very, very young.
Very young, agreed. Very young. Spring chicken.
I do think about a condition called PMOS, also used to be called PCOS. Do you remember that? We used to call it polycystic ovarian syndrome, and it had a rebranding into polyendocrine metabolic ovarian syndrome.
Yes.
Regardless, basically it means that your ovaries are a little bit stuffed up by the presence of too much insulin in your bloodstream, and that is because usually a combination of your genes and a high-carb diet is making you overproduce this hormone insulin that makes you ovulate when your ovaries are not quite ready. And one of the consequences of that is that you don't have enough progesterone, but instead you have a buildup of testosterone in your bloodstream. And that contributes to sweating. It can give you acne. It can give you hair where you don't want it, sometimes around your nipples, sometimes the snail trail. Sometimes like it starts growing down the insides of your thighs, but the common is chin, neck and chest. And instead of looking like the little bum fluffy ones that we all get all over our cheeks, they actually look more like pubic hairs, those dark hairs that are much harder to get rid of. In good news, dark hair can be lasered off because the laser goes and seeks out the colour in the hair. So once they've gone grey, like tell your friend Anonymous, don't wait till their chin hairs are grey. Laser is not going to work at that point. We have to be plucking them. But what we want to do is get to the bottom of why these things are happening, and that is going to require a trip to your doctor. It is also going to involve a bit of a hard look in the mirror at what you're eating, the amount of exercise you're doing. I know it's largely genetic, but we can get on top of this as long as you're being uber healthy. So you've got to be doing your exercise and avoiding any of your processed carbs. And all processed foods are not good for this condition. But we can use certain contraceptive pills, other medications to try and get on top of this as well.
Okay, so in terms of fixing it, once you have seen the doctor, would laser work? I mean, I've lasered bits.
Yeah.
Maybe not my chin, but, there's always the future.
Yeah. And do it before the hairs go grey because then laser doesn't work.
Oh, doesn't it?
No.
Okay.
No. Yeah, look, there is this weird thing that when your testosterone levels are high and they prime the hair-growing cells inside the follicle, so they sit with your oil, like together, the hair comes out where the oil comes out. Once the testosterone has switched on those hair-growing follicles, unfortunately, even if we lower your testosterone, often the hairs continue to grow. This is not good news for women who are in perimenopause, but for even girls who've got polycystic ovarian syndrome, they can just keep coming. So that's why we love a permanent hair solution like a laser. It's so perfect for a dark hair because, of course, laser seeks out colour. So it loves a dark hair, hates a grey hair. Well, Cath, for anyone who's out there growing chin hairs who perhaps doesn't have PMOS, it could be perimenopause, which is a time where chin hairs often make an unwelcome entrance to the scene of the whole facial situation of peri. But I do have good news.
What's that, Dr. Ginni? Tell me.
Fairy Peri is here.
Yay!
Oh, my goodness. It's been so amazing. It's been created by Mamamia. It features 25 of the world's seriously top gun experts in perimenopause.
Including you.
And you.
Well, I'm not one of the specialists, but you are.
I am. And we had so much fun doing this together. It was just so good. And the info in here is like top notch. It's not, hate to say it, Cath, but it's not all woo-woo. It's actually mostly seriously science-based and really beautifully explained to make it really, really easy to digest.
So Very Peri is an on-demand video platform that you can go to at veryperi.com.au.
Okay, that is it from us, Cath. Another episode of Well just smashed out of the park. I love it. Don't forget, everybody, to follow the show so you never miss one of these amazing episodes. It's just going to drop straight into your feed automatically. How good. And if you're feeling nice, and who is not nice, who listens to this great podcast, please leave us a rating and a review on Apple Podcasts or Spotify. Thank you.
Please, please, please. And if you want to hear your asking for a friend question, send us an email or voice note to well@mamamia.com.au and we, and by we I mean Dr. Ginni, will get to the bottom of it. And please remember, information discussed in this podcast is for education purposes only and is not intended to provide professional medical advice. Please seek your own medical advice specific to your circumstances from your healthcare professional. See you next time.
And you stay well.
Mamamia acknowledges the traditional owners of the land we've recorded this podcast on, the Gadigal people of the Eora Nation and the Wonnarua people. We pay our respects to their elders past and present and extend that respect to all Aboriginal and Torres Strait Islander cultures.